Assalamu alaikum. Radiological anatomy of the heart. The heart is a pyramidal in shape and lies obliquely in the chest from the second to the fifth rib. It has a square base posteriorly and elongated apex pointed inferiorly and to the left. It has 4 chambers. The left atrium, which is the base, it is where the superior and inferior pulmonary vein drain. The right atrium forms the right border, cava drains into upper and lower parts. The left ventricle forms the apex and the left border. The right ventricle forms the anterior part, and the diaphragmatic inferior surface formed by the ventricles anteriorly and small part of the right ventricle, right atrium posteriorly, where the inferior vena cava drain. The long axis of the intereta runs obliquely to the left. Thus, it is left anterior oblique. The transverse axis of the tricasp and mitral valve run anteriorly to the right. Thus, it is a right anterior oblique. It is also obliquely oriented, so the ventricles lie anterior and inferior to the atria. It is also clockwise rotated, so the right atrium and ventricle is higher than the left side. So this is a chest X-ray showing the right atria, which is the right border of the heart, the right ventricle, which is the most anterior chamber of the heart, the left ventricle, which forms the left border and the apex of the heart, and the left atria. Okay, with the right ventricular outflow formed by the aorta and the aortic arch and the aortic knob. This is the superior vena cava and the main pulmonary artery. This is a multiplanar reformation of CT and MRI on the right, showing the 4-chamber view with the right atria, right ventricle, left atria, and left ventricle, and the interventricular septum and interatrial septum in between. The pericardium. In case the heart and its major vessels, it consists of 2 layers, outer fibrous layer and inner serous layer. The serous pericardium consists of outer parietal layer and inner visceral epicardial layer. The space between them contains about 20 to 20 ml of serous fluid. The parietal layer is free, except inferiorly where it bounds to the central tendon of the diaphragm, while superiorly it extends to cover the great vessels up 2 to 3 cm. So this is illustration showing the most inner layer. This is the myocardium. The white with the blue borders, this is the serosa layer with the parietal and visceral layer, and the green one is the fibrosa. This is an MENC showing the reflection of the pericardium over the major vessels. Some fat present between the cardium and myocardium and between the pericardium and mediastinal pleura. Fat deposit in the anterior and lateral cardiophrenic angles known as the pericardial fat pad. This fat increases with age. So this is a lateral chest X-ray showing the pericardial fat pad, and this is an axial CT scan showing the pericardial fat pad bilaterally, indicated by the blue arrow. Radiological feature of the pericardium. The pericardium is visible on CT as a thin, dense line, separated from the myocardium by a thin layer of epicardial fat. On MRI, it is seen as a dark line about 1 to 2 mm thick. So this is an axial CT showing normal pericardium separated from the myocardium by a fat layer. This is a pathological where it is filled with fluid. Pericardial recess. Reflection of the pericardium, which can be mistaken for lymph node, cyst, or tube common sinus.
How much is small?
بس هذا ميوت الكل تسمعون
لا ماكو الصوت راح.
سارة موجودة؟
سارة
أي موجودة
يلا.
نعم موجودة.
الصوت راح.
أي نعم موجودة. Okay. The most common sinus is the oblique pericardial sinus. The oblique pericardial sinus occurs between the left atrium anteriorly and the esophagus posteriorly. It is a J-shaped cul-de-sac sinus posterior to the heart. The transverse sinus by a reflection of the pericardium that runs between the right and left superior pulmonary vein. So illustration showing the oblique pericardial sinus. It is a posterior to the left atria and between the left atria and the esophagus posteriorly. This is the oblique pericardial sinus. This is an axial CT showing the oblique pericardial sinus in white arrow, and the small arrow indicate the transverse sinus. It is separated by fat. The transverse sinus. This occurs anteriorly and superiorly to the left atrium. It is between the aorta and the pulmonary trunk, anteriorly to the superior vena cava on the right and left atrial appendage on the left. This is the transverse sinus between the aorta and the main pulmonary artery on the right and superior vena cava and left atrial appendage on the left. This is an axial CT, contrast enhanced CT showing the transverse pericardial sinus with the pericardium. There are several pericardial recesses forming small pockets that extend from or towards the transverse sinus that may also mimic mediastinal lymph nodes or disease. The most important one is the superior aortic recess. So this is an axial CT showing normally pericardial recess, which is a water equivalent attenuation with no walls or no enhancement, indicated by the yellow arrow. And this is pathological with enlarged lymph node. This enhanced, indicated by the white arrow. Superior aortic recess consists of anterior, right, lateral, and posterior portions. The anterior portion is triangular in shape and is between the aorta and the ascending pulmonary artery. Fluid here may mimic the aortic dissection. The lateral portion is between the aorta and the superior vena cava, while the posterior portion is posterior to the ascending aorta. And this is called the superior pericardial recess or the superior sinus. So this is an axial CT showing the superior aortic recess. The anterior portion is indicated by the orange arrow, and the lateral portion here is between the aorta and superior vena cava, while the posterior portion indicated by the blue circle. This is the posterior portion. Cardiac chambers and valves. The right atrium is an irregular ellipsoid shape. The posterior wall is smooth, where the inferior vena cava and superior vena cava drain. The coronary sinus also drains into it between the inferior vena cava and the tricuspid valve. The Bayesian valve is situated at the opening of the coronary sinus. Lateral wall is the interatrial septum, bears an oval depression. In its lower part, this is the fossa ovalis, which is a closed foramen ovale. A raised limbus surrounds the fossa ovalis. The anterior wall, trabeculated by musculi pectinati, with the vertical ridges, this is the crista terminalis. This represents the line of fusion between the anterior and posterior wall. Right atrial appendage is a triangular in shape, arises from the anterior wall and projects forward, upward, and to the left. It is the only portion of the right atrium seen on lateral chest X-ray. So this is on the left an axial CT, and on the right, this is a 3D reconstruction showing the right atrial appendage indicated by the blue arrow. Right ventricle. It is a triangular in shape and flattened from front to back as the left ventricle bulges in. It is the most anterior chamber and its wall thinner than the left ventricle. It is separated from the left ventricle by the interventricular septum, which bulges into the right ventricle. It has two tracts, the inflow and outflow, which is separated by the conus arteriosus, also known as the infundibulum. The inflow tract is by the tricasp valve, which has three leaflets, the anterior, posterior, and septal. Each one is attached to the papillary muscle by the chordae tendineae. There are three papillary muscles that attach to these leaflets. It is the anterior, which is the largest, attached to the anterior and posterior leaflets. The posterior, which is the smallest, attached to the posterior and septal leaflets. The septal is attached to the anterior and septal leaflets. The outflow projects superiorly and posteriorly to the left as the pulmonary valve, which has three semilunar cusps. The septomarginal trabeculae, or the moderator band, arises from the apical interventricular septum and extends to the anterior papillary muscle. It contains the right branch of the AV bundle. On contrast CT or MRI, the right ventricle on axial scan can be considered enlarged when the transverse diameter is larger than 60 mm in male and 57 mm in female, while the right atrium can be considered enlarged when the transverse diameter is larger than 67 in male and 64 in female. So the characteristic shape of the right ventricle is by the moderator band, the septal papillary muscle, the infundibulum, and it has no fibrous continuity with the atrioventricular valve. This is the outflow tract. So this is an axial CT, axial image on left and sagittal oblique on the right, showing the right ventricle with the moderator band, the right atria, and the left ventricle. Left atrium, most posterior superior chamber. It is a square shaped, receives 4 pulmonary veins. Curving anteriorly to the left around the pulmonary trunk. It is trabeculated by muscles, unlike the main horizontal muscle, should not be mistaken for thrombus. On contrast enhanced CT or MRI, the left atrium can be considered as larger than 50 mm in male and 45 mm in female. This is an axial image on the left and 3D reconstruction illustration on the right, showing the left atrial appendage, which indicated by the yellow arrow. Left ventricle, it is a conical shape, thick muscular wall chamber, thickens on the base and thins to only 1 to 2 inferiorly. The interventricular septum projects into the right ventricle to high pressure gradient. Bulge the left indicate a raised ventricular pressure, right ventricular pressure. The inflets, largest anterior and smaller posterior. They attach by the chordae tendineae anterolateral and posterior-medial groups. The mitral valve separates the inflow from the outflow tract by the anterior cusp and it is in fibrous continuity with the aortic valve. The outflow is by the aorta and the aortic valve, the three semilunar leaflets, the anterior, right, and left posterior. Above each cusp is a localized dilatation, which is a sinus of Valsalva. The anterior sinus, also known as the right coronary sinus, gives rise to right coronary artery. The left posterior sinus, also known as the left coronary sinus, gives rise to the left coronary artery. The right posterior sinus, also known as the non-coronary sinus, gives no artery. So this is illustration showing the right anterior coronary sinus giving the right coronary artery, the left posterior coronary sinus giving the left main coronary artery, and this is no coronary sinus. On axial CT or MRI, the left ventricle can be considered enlarged when the transverse diameter on axial scans is less than 58 mm in male and 53 mm in female. This is an axial on the left reconstruction. This is a 3-chamber view, and this is a coronal reconstruction on the right, showing the relationship between the left atrium, left ventricle, and the aorta. So this is the aortic valve showing the right, left posterior, and this is no coronary sinus. This is the left atria, left ventricle with the left ventricular outer tract formed by the aorta and the aortic valve. Coronary arteries and vein. Right coronary artery. It is arise from the anterior coronary sinus of Valsalva and passes to the right between the right atrium and pulmonary trunk to descend into the atrioventricular groove. Then passes posteriorly into the interventricular groove to anastomosis with the left coronary artery. The branches giving the proximal right coronary artery gives the conus artery, which is the first branch in 50 to 60% supplying the pulmonary trunk. The sinoatrial nodal artery supplying the SA nodes. The mid portion of the right coronary artery gives the right ventricular branch and the marginal artery, which supplies the right ventricle. The distal portion of the right coronary artery gives the atrioventricular nodal artery supplying the AV nodes, the posterior left ventricular branch, and the posterior descending artery, also known as the posterior interventricular artery. So this is a terminal branch of the right coronary artery in the interventricular groove supplying the inferior surface of the left ventricle and 2/3 of the interventricular septum. This is a left anterior oblique 30-degree for angio for showing the right coronary artery indicated by the number 7. This is the right coronary artery. The number 8 is the marginal artery. This is the posterior descending artery and the left posterior ventricular artery. Left main coronary artery arises from the left posterior sinus of Valsalva and passes to the left of the pulmonary trunk in the atrioventricular groove and bifurcate early into anterior descending artery, also known as the anterior interventricular artery. This descends anteriorly in the interventricular groove and gives septal branches and diagonal branches, supplying the anterolateral wall of the left ventricle. And the second branch is the left circumflex artery. This continues laterally and posteriorly to anastomose with the right coronary artery and gives the obtus marginal, supplying the lateral wall of the left ventricle and atrial branches. This is illustration showing the right coronary artery with the conus artery, right ventricular artery, and acute marginal artery, curving posteriorly, forming landing artery, and the left main coronary artery, giving the anterior, curving posteriorly the left circumflex artery, giving the obtus marginal branches. This is the left main, giving the obtus marginal circumflex, and this is the left anterior descending artery. There is a variant, which is a trifurcation of the left main coronary artery. It is the ramus intermedius. This is a trifurcation of the left main coronary artery, here indicated by the red arrow. It occurs in 15 to 30% of population. The coronary dominance is determined by vessels supplying the inferior and lateral wall of the left ventricle. So when the right coronary artery gives the posterior descending artery, it is a right dominant circulation, which is the most common. It is 65 to 70%. When both the right coronary artery and left circumflex artery contribute, so it is a co-dominant. It occurs in 20 to 25%. And when the left circumflex artery gives the posterior descending artery, it is a left dominant. It occurs in 10 to 15%, so this is rare. Veins of the heart. Venous drainage of the heart is mainly 60% by veins that accompany the coronary arteries. They drain into the coronary sinus. The coronary sinus occurs posteriorly in the atrioventricular groove and drains into the posterior wall of the right atrium. Its tributaries is a great cardiac vein, middle cardiac vein, small cardiac vein, posterior vein of the left ventricle, vein of Marshall, which is the oblique vein of the left atrium, anterior cardiac vein. This is drain the anterior surface of the heart into the right atrium, and vena cordis minima, also known as the Begian veins, drain directly into cardiac chambers. Radiological imaging of the heart, chest X-ray. The PA film is preferred to the AP as the heart is much closer to the film and is not magnified. The cardiothoracic ratio is less than 50% in adult and up to 60% in infant. So this is a chest X-ray showing the left atria, left atrial appendage, here its site. This is the right atrium. This is the right ventricle, and this is the left ventricle. This is a cardiomegaly. Its ratio calculated by the A and B in ratio to the C, which is the thoracic diameter. It is normally should be less than 0.5%, so it is 0.6%. So this is a case of cardiomegaly. Valve position. It can be detected on frontal and lateral chest, right cardiophrenic angle. And laterally, it is aligned from T5 to the anterior or to the apex of the heart. So the pulmonary valve and the aortic valve should be above the line. Computed tomography shows the heart and major vessels for greater advantage for demonstration of cardiac chambers and vessels. Non-contrast CT for calcification and atherosclerosis. The multiplanar reformation for CT images can reproduce multiple standard plane. So the first one is the vertical long left ventricular long axis apical to chamber. This is a parasite ventricle. So this is a vertical long axis showing the left atria and the left ventricle. This is along the long axis of the left ventricle. The horizontal long axis, this is a 4-chamber view image through all chambers, assessing the size and valve position. So this is the 4-chamber view. Left ventricular outflow, this is a 3-chamber view. This is a parasternal oblique long X, assessing the left atria, left ventricle, aortic root, mitral valve, and the aortic valve. So this is the left atria, left ventricle, left ventricular outflow, and the aorta. Left ventricular short axis, this is an oblique coronal perpendicular to the long axis of the lumen. Long axis of the left ventricular lumen. Okay, this is an image showing the left ventricular short. This is the epicardium, left ventricle, myocardium, and endocardium by the red arrow. This is the video cross section through the chest. This is the right ear. This is the IVC. This is the left atria, and this is the right. This is the IVC. Okay, this is a CT, coronary angiography, showing the vessels. This is the right coronary artery projecting anteriorly. This is the left anterior descending artery. This is the left circumflex artery, and this is the aortic valve. Magnetic resonance imaging. Image is gated with ECG to overcome the motion artifact. The cardiac chambers, valves, and major vessels may be imaged in any plane, with the added advantage of soft tissue demonstration. Non-contrast studies to assess the cardiac wall morphology, while the contrast is for coronary vessels. So this is an MRI showing the right ventricle. This is the tricuspid valve, right atrium, left ventricle, interventees are chordae tendineae. This is an MRI, coronal and axial sections showing the right ventricular outflow. This is the left ventricle with the apex, right atrium, ascending aorta, main pulmonary artery, left ventricle. This is an axial imaging showing the aortic arch, trachea, superior vena cava, okay, ascending aorta, and descending aorta. Quiz.
سارة صوتك اختفى.
السيليكويس تايم.
تسمعني عمو؟
اي هسه رجع. يلا نبدي. رقم 1 دكتور عماد.
عيون استاذ. هذا الرايت فنتركل.
اوكي كويز تايم.
رقم 1 قال الرايت فنتركل. مرتضى.
نعم أستاذ. رقم 2 left ventricle.
ليف فنتركل. فرح زهير. رقم
نعم أستاذ.
3.
interventricular septum.
هو شنو هذا الفحص؟ فرح.
أستاذ سيتي سكان.
سي تي وذ كونتراست مو صحيح؟
نعم.
هم راحت الصورة.
رايت علاء نايف. رقم 11
أستاذ إيسوفيغاس.
اسوفيغاس. شيماء مجيد 12.
نعم أستاذ، هذا الديسندنج أيورتا.
زين. سماء عطية 13.
نعم أستاذ. هذا الأزايغس فين؟
خلصن مو؟
اي خلصن هن بس 13 واحد.
استاذ مسموح المداخله مسموحه استاذ لو ما
تفضل
مناقشة.
تفضل.